Differentiate between the post-surgical pain, so which would be pain in your residual limb, in the body that's still there, that may be pain across the incision, maybe pain where the bone was cut. These things, those pains really should be diminishing and going away within days to weeks after that surgery.
I think that's the most important thing to say, is that what you're going to find is within the next couple of weeks, though, because I think a lot of times too, people confuse the phantom limb pain with post-operative pain. Like, you are getting phantom sensations at that point, because they become so aware. Like, the first thing they think is, I can feel my toe, but I don't have a toe. Why is this happening? And then you've got all this external pain, just because it's a traumatic type of surgery. So it's not so important. I think what's important is that you should notice that those levels of pain are decreasing over the course of the next few days, and it's not as intense.
Especially the post-surgical pain in your limb. The phantom pain is going to be a pain in the part that's been removed. So it may, I mean, if you had an amputation below the knee, you may feel a stabbing sensation in the arch of your foot. Or you may, I've heard people talk about burning or electrical shocks that are occurring in different parts of their ankle or their toes at different times. And the thing that's so hard about that to manage is there's not an arch or a toe to rub down there. So you have to find a spot in your residual limb that you can kind of use to distract from that pain. And that's why talking to your doctor and physical therapist and prosthetists are so important, is because we're going to know the pathways of the nerves. We're going to know the nerve that is going to affect your big toe. So we might be able to suggest on your limb where to apply pressure when that happens, versus just kind of going in the dark about it.
Teaching people massage techniques right away, that's very important. Getting hands-on with your limb. Massaging the suture line so you don't have adhesions. All those things are going to help with phantom pain as well.
Yes. And residual limb pain. Let's say that you're 1-2 years post-surgery, and every time you put your prosthesis on, there's pain. Most likely that's not phantom pain. Most likely that's pain being caused by the fit of your prosthesis. A lot of times these things can be rectified through adjustments to the fit. A properly fitting prosthesis shouldn't cause pain on the limb that's intact. There's lots of questions about when should I go to my doctor versus when should I go to my prosthetist. If you're feeling pain in an area on your body that you can't touch, a part that was removed, that's the time to talk to your doctor that there's probably something inside your limb that can be fixed through medication or other interventions. If it's pain on your limb that you can touch, then it's time to talk to your prosthetist to find out, is your prosthesis designed the correct way? Would a small change make a difference for you?